We are starting with the endocrine system. This is the beautiful picture which histologically shows pituitary gland, thyroid parenchyma, adrenal cortex, and parathyroid gland. This is the algorithm we are going to follow. Posterior pituitary gland, which is further divided into anterior pituitary and posterior pituitary, thyroid gland and parathyroid gland, pancreas, endocrine pancreas, adrenal cortex, and medulla. In these endocrine organs, we are going to discuss their non-neoplastic conditions like hyperfunctioning and hypofunctioning, and as a result of these hyper and hypofunctioning of endocrine organs, what changes take place in the body. Neoplastic conditions, which are divided further into functional, like that is due to hormones, and non-functional and functional endocrine malignancies. Functional endocrine malignancies are rare. Endocrine system works through positive and negative feedback systems, and these systems like from signals from cortex and subcortex are transmitted to hypothalamus, and hypothalamus then transmit those signals to anterior pituitary, and then anterior pituitary releases hormones, and those hormones act on the endocrine organs, and as a result of which, end organ, which now the hormones are released, and when there is excess amount of hormones in the body, negative feedback signals are sent to the hypothalamus, which further act to release inhibitory hormones and inhibit the secretions from the anterior pituitary gland. Now, endocrine system is basically works through the release of the hormones, and those hormones that act on the target cells, which the hormones are released into the blood, and then they act on the target cells, and as a result of that, there is a long-term and slow response. Now, endocrine system, as we have discussed, they function through positive and negative feedback. When their positive feedback is that when there is buildup of hormones, and that tells the hypothalamus to increase secretion through releasing hormones, this is positive feedback. And when there is buildup of hormones and that they tell the hypothalamus to decrease their secretion through releasing hormone, or is called negative feedback. So hypothalamus, like it releases releasing hormones, and that act on the anterior pituitary, and anterior pituitary then release those through hormones into the bloodstream, and that they act on the target organ, like thyroid releasing hormone is released from hypothalamus, that acts anterior pituitary to release thyroid stimulating hormone in the blood circulation, and that act on the thyroid gland and result in secretion of thyroid hormones like T3 and T4. And when these T3 and T4 gives negative signals to the hypothalamus that to stop secretions, then there will be decreased secretion from the anterior pituitary. And when there is a positive feedback, it will cause hypothalamus to release more amount of releasing hormones, and then more TSH and more T3 and T4. So anterior pituitary acts as a Wi-Fi, and posterior pituitary are the wires. And pituitary gland, it's a size of a pea, and it's inferior to the hypothalamus, and it comprises of anterior pituitary lobe and posterior. Now, anterior pituitary lobe is further divided into adenohypophysis, rectus pars, and pars distalis, and is comprised of this vascular system in which these results in release of hormones that act on the target organs. While posterior pituitary, also called neurohypophysis, is comprises of these axon terminals, and these and their swellings, which are called herring bodies. Actually, the hormones, they are synthesized in the hypothalamus, and they are stored in the posterior pituitary and they release when they are required. So posterior pituitary are the wires and anterior pituitary hardwired, and anterior pituitary act as a Wi-Fi. This like it's otherwise round, the anterior pituitary is in front and it comprises of these endocrine cells, and when there are signals from the hypothalamus to release those hormones that act on these cells and of anterior pituitary, and that releasing secretion of hormones. These hormones really are TSH, thyroid stimulating hormone, that act on the thyroid gland, and ACTH, adrenocorticotropic hormone, that acts on the adrenal cortex of the adrenal gland to release glucocorticoids. FSH and LH, follicular stimulating hormone and luteinizing hormone, that act on testes and ovaries. Now, basically growth hormone, it's like it acts on the entire body or the bones to increase, like results in growth of an individual. And it's more in adolescence, and afterwards its amount decreases. Prolactin, PRL, that acts on mammary glands in mammals, then releases secretions and results in secretion of milk during lactation. Endorphins, like they are pain receptors in the brain, and this gives the concept of painkillers, like they which act on this, and which are like analogs of these endorphins and decreases the sensation of pain. Now, posterior pituitary are basically the axon and axon terminals, and their swellings at the end called herring bodies, and specialized neurons called pituitary. Hormones of the posterior pituitary are synthesized in the hypothalamus, and they are stored and they're in the posterior pituitary gland, and they're released into the bloodstream when they are needed. Like the hormones are oxytocin acts on the uterine muscles and mammary glands. Uterine muscle, it's also called a birth hormone, that during delivery of a body they causes contraction of the uterine muscle that result in expulsion of the baby outside. And then after that, during lactation, it acts on the muscles within the mammary glands, result in expulsion of milk. ADH, antidiuretic hormone, that acts on the kidney tubules and results in conservation of water. ADH, like when patient is dehydrated, results in it it reabsorption of water from the renal tubules to conserve water through their specialized receptors, like they increase the number of aquaporins in the renal tubules, and that they results in reabsorption of water. These are the normal range of hormones in the blood, and like luteinizing hormones and follicular stimulating hormone, their levels in the body decrease at menstrual phase, and prolactin also decreases at menstrual phase. Now, what are hormones? Hormones are basically polypeptides out of basically two types, like polypeptides, protein derivatives, and they act through second messengers and they on the target cells through receptors on the plasma membrane of the target cell. Steroids, like steroids include which that on like thyroid hormones uh, and cortisol that acts directly on the nucleus. So broadly they are divided into proteins and lipid, polypeptides and steroid hormones. This is the histologic picture of anterior pituitary glands, which shows this anterior of a pituitary gland. Anterior pituitary gland comprises of acidophils, basophils, and chromophobe cells. An intermediate pituitary gland and a posterior pituitary, which is composed of these axon terminals, and specialized neurons, pituocytes. And pituitary gland has a portal circulation like arteries, capillaries, and venues, which help out in this secondary like circulation of hormones that acts through hypothalamus on the pituitary gland, like releasing hormones in that released by the hypothalamus, and those releasing hormones called stimulation of the stimulating hormones from the anterior pituitary. So this feedback system acts through portal circulation in the pituitary gland. This is the hyper view of the anterior pituitary gland, which is comprises of these acidophils and basophils cells, which composed of these like basophils more blue cytoplasm, basophilic cytoplasm, and granular basophilic cytoplasm, and acidophils more eosinophilic cytoplasm. And there are third cells like chromophobe cells, which are colorless cells, and they do not have like any specialized function in the anterior pituitary gland. And these acidophil cells and chromophobe cells are arranged in an acinar pattern, and these are separated from each other by a fibrovascular core that is more like there is a vessels around this acinar like arrangement of the acidophils and basophils that is more highlighted by the red. Now, anterior pituitary basically comprises, as we had discussed, two types of cells, acidophil cells and basophil cells. Acidophil cells basically they release are more are related with the growth of an individual, and they release growth hormone and prolactin hormone, result in secretion of growth hormone and prolactin hormone. Basophil cells are trophic cells. They are released into the bloodstream and they act on the target organs like thyroid gland. That results in release of thyroid stimulating hormone, adrenal cortex like release ACTH, and ovaries and testes that results in secretion of LH and FSH. So basophils they go to the target organ through bloodstream, and acidophils they directly act on the body. Posterior pituitary stores two hormones like that are synthesized in the hypothalamus, and they are stored in the posterior pituitary, which is comprises of axon and axon terminals, like oxytocin, which contracts uterine smooth muscles during delivery of a baby, and vasopressin, ADH, antidiuretic hormone, which main function is to concentrate the urine and reabsorption of water through the renal tubules. So vasopressin mainly act on the kidneys and brain and results in vasoconstriction. Gluconeogenesis also causes platelet aggregation, release of factor 13 and von Willebrand factor, and main function that is like to concentrate the urine. Now, what happens with the pituitary gland? Like causes of disorder of pituitary gland are mainly of basically two reasons. Like if it is hyperactive or there is more secretion of the hormones, or it's hypoactive and there are less amount of hormones that are secreted into the blood. Basically, like this is the skull, and that shows the pituitary gland, which is the size of a pea, and it's inferior to the hypothalamus, and it's in the resides in the sella turcica bone, and which is most of the 75% of the pituitary gland is comprises of adenohypophysis and anterior pituitary gland. And we will discuss in detail like what conditions like that results in hyperactivity or hypoactivity of the gland, and as a result of different conditions. Now, disorders of the pituitary glands are like anterior pituitary gland. We have discussed any tumors like hyperplasia or pituitary adenomas that results in hyperactivity and hypoactivity of the gland. If it's hyperactive, it can lead to gigantism like growth hormone. If it's an excess amount and during childhood, acromegaly, this excess amount of growth hormone after closure of the epiphysis of bones, and Cushing disease. Hypoactivity results in dwarfism, short stature. Posterior pituitary hyperactivity results in certain syndromes like syndrome of inappropriate secretion of ADH, and its hypoactivity results in diabetes insipidus.